Actually, speaking of, do you have any other tips that can help parents manage asthma on an everyday basis?
Right. Yeah, there's some tips here. I think the idea is this, in general, that the children and their families need to take ownership of the asthma. It's called self-management. I think that it's extremely important for the child and their family to be very educated, very knowledgeable about what asthma is and what are the triggers and how to deal, and how to prevent problems and how to deal with problems should they arise. So I would say, as a big point of advice, take control. Don't let asthma take control of you. Secondly, I think that as a day-to-day management, you need to be aware of what triggers the child's asthma. And so it could be an allergen like a cat or dog. It could be some other exposure, other allergens in the house, outside the house, dust mites, cockroach, things like that, pollens on the outside. And we don't want the child to live in a bubble, but on the other hand, that should try to be avoided if possible. Good dust control, getting rid of the dust mites is important. And there are also triggers. Besides allergens, there are other triggers, such as tobacco smoke, which is really a major trigger and a problem in many of our families. So I think the first point of asthma treatment is avoidance. Secondly, the child and the family need to be very familiar with the medications and what they do. And they need to take their medicine exactly as prescribed by their doctor. And I think along those lines, I think it's really important in terms of self-management for the families and the child to have a good conversation with their doctor. And the doctor should give them what's called an Asthma Action Plan, AAP. In that plan is an idea what to do when you're doing well, when you're not doing so well, and when you're doing very poorly, and it describes what that all means. And that's the way the asthma should be managed. And that's called an Asthma Action Plan, very important. And so I think that avoidance of triggers and allergens, taking a medication, taking ownership, I think will, in most cases, make asthma a problem that is not going to interfere with a great quality of life.